Hi, my name is Jamel Cortez. This is the second video for my second patient. I'm a student at Herzing University, and this is my crisis management video. Our second patient, I am going to be reading off my PowerPoint presentation that I made for this. So, starting off with patient summary. Patient summary is a 19-year-old female. She is 2 months postpartum, fourth visit to the outpatient clinic. Husband is present. She is talking really fast. She has tangible thoughts, loose association, and she reports that her infant is ugly and crying too much. She plans to leave the baby in the desert because she believes that it is an alien. She is going through a postpartum depression and possibly other symptoms, but we are going to evaluate her and see what we can interject. The next one is diagnostic impression. Her mental status appears to be proactive. Her appearance is proactive attire, heavy makeup. Her behavior, hyperactive. Her speech is pressured, loud, and rapid. Her mood, extremely elevated. Her thought process is tangible and loose association. Her thought content is grandiose and delusional. Her insight is poor. Her judgment is severely impaired. Differential diagnosis. Possible diagnosis is bipolar 1 disorder. Her current episode is manic, psychotic features, and peri-postpartum onset. We're going to have to rule out brief psychotic disorder, schizophreniform disorder. Substance include psychosis and medical issues. The next one we are doing, why is this considered an emotion or an emergency? Although the patient denies suicide ideation and homicidal ideations, she does have active psychotic symptoms. She is lacking reality and needs to be monitored. She reports delusions and she's focusing on the infant, which is, yes, she's our patient, but the baby is also our patient, so she is creating a patient safety issue for that child. She has made harmful plans to danger the infant by abandoning him and leaving him somewhere for no one to find, which is dangerous and harmful to the child. What do you do right now? That is the question. What should we do? We need to do a hospital workup for this patient. A patient workup was complete workup with CBC, CMP, THC, a urine drug test, a pregnancy test, a neurologic exam. We also need to do a psychiatric workup for her. She needs to have a workup for bipolar disorder, psychosis, mania, suicidal risk, and violence risk. All of these will be done in the hospital, and she needs this assessment because of her harmful thoughts to her child. Yes, it is peri-postpartum issues, but this is how they present at times. What is the treatment that we plan to do for her? Hospitalization, we are requiring that. Medication, because she does have bipolar 1. She is presenting symptoms of bipolar 1. Begin a second generation antipsychotic. Begin a mood stabilizer because she is bipolar. She's presenting as bipolar. Provide benzopine if severe agitation is present. If she's coming off as hostile, we will give her benzopine. Possible ECT. We are going to try to steer away from that, but that is a possibility. Family education regarding illness. We do have to educate her on the diagnosis that we are making and the treatments and how it will help her. Sleep should be restored. She needs to regulate her sleep because her sleep has been all over the place. The other thing, we need to consider the legal and the ethical issues on this. We need to protect the baby from the mother. We need to consider child protective services if the baby's safety is at risk. Involuntary hospitalization if the patient lacks the capacity to make medical decisions, if she's not comprehending what we are telling her and the risk that she is putting her child. Involuntary hospitalization and removing of the child or keeping it with the father will be the next steps. What is the long-term treatment for this patient? Psychiatry, medication management, family therapy, psychoeducation, relapse prevention, discuss future pregnancy, and close-up outpatient follow-ups with her. And that summarizes on how I would treat the first and the second patient. Again, my name is Jamel Cortez, and thank you for listening to my presentation.